Hey everyone, welcome back for another deep dive. Today we're looking at a decision aid all about atrial fibrillation.
Okay, AFib.
Yeah, AFib, and this is a big one.
Yeah.
If you're a senior or maybe taking care of one,
Right.
making good choices about healthcare is so important.
Absolutely.
And that's really what we're hoping to help with in this deep dive. We're going to try to break down treatment options for AFib and think about what really matters when making those tough decisions.
Yeah. And this decision aid is really interesting because it's really speaking directly to people who might be dealing with AFib symptoms, even if they're already on medication. It's like it knows that AFib can be kind of a tricky thing. What works for one person might not work for someone else.
Yeah, it's not one size fits all.
Exactly.
And that's really reassuring to hear. So let's just jump right in. The guide starts by explaining just what atrial fibrillation is.
Right.
Can you walk us through that?
Sure. So think of it like this. Your heart has its own electrical system, right? It keeps everything beating in that nice regular rhythm. But with AFib, the top chambers of your heart, they're called the atria. They get their signals all mixed up.
Oh.
Yeah, so then your heartbeat, it's irregular and usually a lot faster than it should be.
So it's like the heart's rhythm is offbeat.
Yeah, you could say that.
But I've heard that there are different types of AFib. Does the guide go into those at all?
It does, and it's actually super important to understand these differences because it can really help you make better decisions about treatment. So first, you have paroxysmal AFib, the episodes that kind of come and go.
Like a temporary glitch.
Exactly. They might last for a few minutes or even hours and then just disappear on their own. Then there's persistent AFib. This one's a bit more stubborn. It hangs around for more than 7 days and usually needs medication or some other intervention to get that rhythm back to normal. And then finally, there's permanent AFib, where that irregular rhythm basically becomes the new normal.
Wow. Okay, so there's a lot to keep track of. So knowing what type of AFib you have is really important for figuring out the best way to manage it, right?
Absolutely. And here's where it gets even more personal. You know how AFib affects you? Could be totally different from how it affects somebody else. Some people may not even know they have it, while other people have symptoms that can really disrupt their day-to-day life.
And the guy actually lists some of the common symptoms. It even has this little checklist to see if anything sounds familiar, like heart palpitations, feeling tired all the time, dizziness, shortness of breath,
Right.
even just feeling more anxious than usual.
Yeah, and maybe this is a good time for our listeners to take a moment and think, especially if you're a senior or a caregiver. Have you noticed any of these symptoms? Because if so, it's definitely worth talking to your doctor about it. Even though doing nothing is always a choice, treatment can make a huge difference in managing those symptoms and just improving your overall quality of life.
You mentioned quality of life. The guide talks about that too, right?
Oh, yeah, for sure.
It's not just about the medical stuff. It's about how AFib actually affects your life.
Absolutely. It talks about how it can affect your energy levels, your ability to exercise, even just simple things like climbing stairs or working out in the garden.
Yeah, those things matter.
Especially as we get older.
It's about living your life to the fullest.
Exactly.
So finding a treatment approach that helps you feel your best so you can keep doing the things you love. Now, I'm curious about those treatment options themselves. What does the guide lay out for us?
Well, it presents 3 main paths that you can consider: doing nothing, taking medication, or going for a procedure called an ablation.
Okay, let's break those down one by one. So you mentioned doing nothing is an option, but you also said that treatment can really improve your quality of life. So how do we balance those two ideas?
That's a great question. And the guide makes it clear that AFib doesn't always get worse over time. So for some people, especially if their symptoms are pretty mild or they don't happen very often, just watching and waiting might make sense. But there are also some potential downsides to think about.
Like what? Why might doing nothing not be the best idea?
Well, one thing is your symptoms could become more severe, or they might start happening more often. And that can obviously impact your quality of life. There's also the risk that if you wait too long to start treatment, you might not be eligible for certain options down the road.
So it's a bit of a gamble. You might be okay for now, but there's no guarantee things will stay that way.
Right, and that's why those conversations with your doctor are so important. Together, you can weigh the pros and cons and decide what feels right for you.
Okay, so we've talked about doing nothing. What about medication? I know that's a pretty common way to manage AFib.
It is, and the guide explains that medications can actually be used in a couple of different ways. There are daily medications you can take to try to prevent those AFib episodes from happening in the first place. And then there's what they call pill-in-the-pocket options.
Pill in the pocket.
Yeah.
That sounds kind of interesting.
It is. Basically, you keep a medication on hand. and you only take it when you feel an episode coming on. It can help get your heart back into a normal rhythm more quickly.
So it's like a backup plan
Yeah,
for
exactly.
those moments when things start to go wrong. That makes sense. But are medications always effective?
That's a really good point. Medications don't work for everyone, and some people might have side effects that bother them. It's really about finding the right medication and the right dose that works best for you, which is another reason why talking to your doctor is so important.
So it's about finding that sweet spot where the benefits outweigh the risks. And that might take some trial and error.
It might.
Okay, so we've covered doing nothing. We've covered medication. Now I'm curious about that third option you mentioned, ablations. What can you tell us about those?
So ablations are procedures that use catheters. Those are those thin, flexible tubes. They use them to disrupt those faulty electrical signals in your heart that are causing the AFib. And there are two main types, left atrial ablation and AV node ablation.
Hold on, two types. It's getting complicated.
Okay, let me try to explain it simply. Think of left atrial ablation like rewiring a faulty circuit in your heart. It's trying to fix the original problem and get your heart back to that normal rhythm. AV node ablation is a little different. It's more like replacing your heart's natural rhythm conductor with a reliable backup.
Okay, so with AV node ablation, you're basically blocking the faulty signals and then relying on a pacemaker to keep the heart beating steadily.
Exactly. And it's actually a two-part procedure. First, they block the faulty signals at the AV node, which is like the junction box of your heart's electrical system, and then they implant the pacemaker to take over regulating your heart rhythm.
So it's like choosing between fixing the original wiring or installing a whole new control system.
Yeah, that's a good way to think about it.
Fascinating stuff. But I imagine each option comes with its own set of benefits and risks.
You're absolutely right, and that's actually what we'll dig into next. The decision aid really lays out those potential pros and cons of each treatment path, which is really important to help you make an informed choice.
All right, so let's talk benefits and risks.
Okay.
This can be a lot to take in.
I know. So I really like how the guide breaks everything down in such a clear way.
Yeah, me too.
It starts off by reminding us that treatment decisions are super personal.
Right.
What works for one person might not work for another.
Exactly. And that's why this decision aid is so helpful. It doesn't tell you what to do. It helps you figure out what's most important to you.
Okay.
And to do that, you really need to understand both the potential benefits and the potential risks of each option.
Okay, so let's start with the good stuff, the benefits. What kind of improvements can people really expect from these different treatments?
Well, the guide actually gets pretty specific here, which I appreciate. It uses numbers from research studies to show how each treatment might impact things like how much your symptoms improve, whether you'll still need to take medication, or even the chances of needing a pacemaker battery replacement down the line.
So it gives you actual data to help you make those decisions.
Right.
Can you give us an example? Sure, let's say you're looking at left atrial ablation. That's the procedure that's designed to get your heart back into a normal rhythm. The guide says that after just one procedure, about 80 out of 100 people with paroxysmal AFib might have fewer symptoms, and some might even be able to stop taking their medication altogether.
Wow. 80 out of 100. That sounds pretty promising.
It does for a lot of people.
But you mentioned that these numbers are from research studies. Does that mean that everyone will have the same results?
That's a really good question, and the guide is careful to point out that results can definitely vary from person to person. These numbers just give you a general idea. But your own experience could be different depending on things like your overall health, how serious your AFib is, and how well you respond to the treatment.
So it's important not to get too caught up in the exact numbers. It's more about getting a sense of what's possible.
Right.
And having realistic expectations.
Exactly.
Now, on the other hand, we have to talk about potential risks. No medical procedure is completely risk-free. And I'm glad that the guide didn't try to hide that.
No, they're very upfront about it.
I think honesty is really key when making these decisions.
It is.
So for each treatment option, they outline possible complications. And they do it using real examples that are easy to understand.
Yeah. For example, with left atrial ablation, there's a small chance you might need another procedure. Or you could have some bruising where they put the catheter in. Or maybe some nausea and discomfort afterwards.
Okay. Those sound like pretty minor risks, especially compared to the potential benefit of actually fixing your heart rhythm.
Right. It's all about perspective. And these types of complications are usually short-lived and pretty easy to manage. The guide also talks about the less common but potentially more serious risks, things like damage to the heart or blood vessels, bleeding, or infection.
So it's about weighing those potential benefits against the potential risks, both the minor ones and the serious ones, and probably talking with your doctor about your own personal risk factors.
Absolutely. They can help you understand which risks might be relevant to you and how likely you are to experience them.
Now, before we move on, I want to mention something that I thought was really important. The guide talks about how AFib can impact everyday life, especially for seniors.
Yeah, it's not just about the medical stuff.
Exactly. It's about staying independent and having a good quality of life.
It's so crucial. And it really comes down to this idea of personalized decisions. When you're thinking about treatment options, it's not just about managing the AFib itself. It's about how those treatments might affect your ability to live the life you want to live.
So if you're a senior and being active and independent is important to you, that might influence your decision about whether to go for something like an ablation, even if there are some risks involved.
It definitely could.
Or if you're a caregiver, you might think about how different treatments could impact your loved one's ability to enjoy activities, or just maintain their sense of self.
That's a great point.
It's about making choices that align with your values and priorities, not just ticking boxes on a medical checklist. And that brings us to a part of the guide that I'm really excited to talk about: lifestyle changes.
Yeah, this is where things start to feel empowering, right? It's about realizing that you're not just a passenger. You can actually take an active role in managing your AFib through the choices you make every day.
And the guide has some really practical tips that can make a real difference, no matter what treatment path you choose. It's not about doing a complete 180 overnight. It's about making small, manageable changes that you can stick with.
And it's so important to understand that these changes aren't just a nice bonus. They can actually have a direct impact on how often you have AFib episodes and how severe they are.
So let's talk specifics. What kinds of lifestyle changes are we talking about?
Well, one of the biggest ones is cutting back on alcohol. Alcohol can be a real trigger for those AFib episodes. So reducing how much you drink or even cutting it out completely can make a huge difference.
So that makes sense. Alcohol can really mess with your heart rhythm, even for people who don't have AFib.
Exactly.
What else is there?
Managing your weight is also really important. Carrying extra weight, especially around your stomach, puts more strain on your heart and increases your chances of developing AFib in the first place. So even a little weight loss can be beneficial.
Okay, so watching your diet and getting regular exercise are key. How about things like stress and sleep?
Oh, those are both so important. Stress can definitely trigger those episodes. So finding healthy ways to manage it, like yoga, meditation, or even just spending time outdoors, can really help.
And sleep is crucial for overall health. So I imagine it plays a role in AFib as well.
Absolutely. When you don't get enough sleep, your body's under more stress, which can make you more prone to those episodes. Aiming for 7 to 8 hours of good sleep each night can really make a difference.
So it's about taking care of your whole self, not just focusing on the heart.
Right.
What about other things that can trigger AFib? Does the guide talk about that at all?
It does. It actually encourages you to become a bit of a detective and try to figure out what your own personal triggers are.
Oh, interesting.
Yeah, it could be certain foods or drinks, specific activities, even emotional states.
So pay attention to your body and notice what might be setting off those irregular heartbeats.
Exactly.
And once you figure out what those triggers are, you can start to avoid them.
Or find ways to minimize their impact.
I love this. It's like taking back control of your health and not just feeling helpless.
That's exactly it. That's the message the guide is really trying to get across. You have a lot more power than you think when it comes to managing AFib. It's about working with your doctor to find the right treatment plan and making those proactive lifestyle choices that can support your heart health.
A two-pronged approach. You've got the medical side of things, but you also have the power to make choices that can really make a difference in your experience.
Exactly.
The guide gives you the knowledge and the tools to do both.
It does.
Okay, so we've covered a lot. Understanding the different types of AFib, making personalized treatment decisions, the potential benefits and risks of those options, and the power of lifestyle changes. What else does the guide offer to help people navigate all of this?
Well, one of the most helpful things, in my opinion, is the questions for your specialist section. It's like a cheat sheet for when you go to see your doctor.
Oh, that's such a great idea. I know how overwhelming those appointments can be,
Oh, yeah.
especially when you're trying to remember all the things you wanted to ask.
Right. This section makes you think about things like your specific symptoms, your concerns, your lifestyle, and your goals for treatment. It helps you explain what's most important to you so you can really have a productive conversation with your doctor.
It's about being an active participant in your healthcare, not just a passive patient. And that can make you feel so much more empowered and confident in the decisions you're making.
It really can.
And speaking of feeling empowered, the guide also has links to some amazing resources that can give you even more information and support.
It does.
Tell me more about those. I'm always looking for good resources to share with our listeners.
Well, they mention organizations like the AF Association, the Arrhythmia Alliance, and the British Heart Foundation. These are all really well-respected groups. They offer a ton of information about AFib, plus support groups and other resources for people with AFib and their caregivers.
That's fantastic. It's so important to know that you're not alone in this. There's a whole community out there ready to help.
And these groups can also help you connect with more tools and strategies for managing AFib. They can even help you advocate for your own needs and navigate the healthcare system, which can be pretty confusing sometimes.
It's about building a support system that can help you feel informed and empowered and confident in your ability to live well with AFib.
You said it perfectly, and I think that leads us perfectly into that final thought-provoking question the guide leaves us with.
Ooh, I love a good thought-provoking question. What is it?
It asks, knowing all of this information, what parts of managing AFib feel most important to you now? What would you want to talk to your doctor about first? How could you start incorporating some of those lifestyle changes into your daily routine?
Those are some really powerful questions.
Yeah.
It's about taking everything we've learned today and actually applying it to your own life.
Exactly, because ultimately, the best treatment decision is a personal one. It's something you decide with your doctor based on your own values and priorities.
And this decision aid is such a great starting point for those conversations. It gives you the knowledge you need to ask the right questions and advocate for yourself.
So as you move forward, remember that you're not just along for the ride. You're an active participant in your own health journey.
Wow, this has been a fascinating deep dive.
Yeah, for sure.
We've covered so much ground, but in a way that feels really manageable and kind of inspiring, actually.
That's exactly what this decision aid is all about. It gives you that knowledge and those tools to really take control of your AFib journey.
So you don't have to feel overwhelmed or confused.
Right.
You can feel more confident about making those healthcare decisions and feel like you have some control.
Exactly. And remember, this guide is just a starting point. It's really meant to get those conversations going with your doctor and help you ask the right questions.
Because in the end, the best treatment decisions are made together, with you and your doctor working as a team.
And that team can also include other healthcare professionals too, like nurses, pharmacists, maybe even therapists or dietitians.
Yeah, it's about creating a whole support system that can address all aspects of your well-being, both physically and emotionally.
Because managing a chronic condition like AFib, it's about more than just treating the symptoms. It's about living a full and meaningful life, even with those challenges that AFib might bring.
And that's where those lifestyle changes we talked about are so important. They can really make a huge difference in your experience with AFib and how well you can manage it.
It's about being proactive, not just accepting a diagnosis.
It's about taking charge of your own health journey.
And that can be so empowering.
Absolutely. And just remember, you're not alone in this. There are so many other people out there who are going through the same things, and there's a whole community ready to support you.
So reach out to those resources we mentioned, connect with others who get it, and keep learning.
Because knowledge is power, especially when it comes to your health.
So well said.
Well, that's all the time we have for today's deep dive into understanding AFib and making informed treatment decisions.
We hope you found this information helpful and maybe even a little inspiring.
Until next time, keep exploring, keep asking those questions, and keep taking charge of your health.